Welcome to Critical and Coronary Care at the Queen Elizabeth University Hospital. We appreciate it can be very difficult having a loved one in critical care, and we understand that the environment can be daunting. So we want to tell you a bit more about the unit, introduce some of the staff you may see, and explain their role in looking after your family member. The unit may seem large, but the easiest way to find the person you're visiting is by using their bed number. And there are maps situated around the department to help you find your way. Each unit has secure access, so please press the buzzer at the entrance and staff will let you in. Staff may be busy giving patients the specialist care they need, so please be patient. If you've waited longer than 5 minutes, speak to our receptionist who'll contact the unit. If there's no receptionist, please phone the appropriate number listed on the display board in the reception area. We have a large multidisciplinary team working in critical care. Every patient within our department has a designated consultant, and you may also see visiting consultants who provide specialist advice. Nurses are with patients day and night, monitoring vital observations, giving medications, and helping with personal care. Each of the 7 units is run by a senior charge nurse. You can find their name and their photo at the entrance to the unit. There is also a designated nurse in charge of every unit on every shift. This nurse wears a red badge. Pharmacists will attend daily ward rounds and advise our medical teams around the safety of medications in relation to patients' treatment. Our team of allied health professionals are dressed with a badge outlining their specific role. Physiotherapists provide respiratory support for patients and begin rehabilitation as soon as they are medically well enough. We encourage everyone that can get up and moving to do so. It is vital to start recovery as soon as possible, even if someone is still ventilated. It's important for our patients to get enough calories to help recover. Not all of our patients are able to eat and drink, and so dietitians assess and prescribe the appropriate feed. This is generally given by a pump via a tube inserted in the nose called an NG tube. Most of our x-rays are performed within the department, and so you may see radiographers with the machines from time to time. Speech and language therapists may work with people to improve their communication and swallow function. We also have healthcare support workers and students to assist with care. And you may see porters, domestic staff, housekeepers, and ward clerks who play a very important role in the day-to-day running of the unit. This is a typical bed space in critical care. It does look quite different to that of a ward, with the pieces of equipment that help support patients. All patients are continuously monitored, and this allows us to see their heart rate, blood pressure, and oxygen levels. This close monitoring allows us to alter treatment as required. Many of these will alarm at times to alert staff they require attention. This can be done either at the bed space or from the central monitor at the nurse's station. Some patients need help with their breathing, and there's a range of equipment we use for this, including face masks and nasal tubing. If the patient needs additional support, we may use a ventilator, but this would be explained when you visit. Nearly all of our patients will require intravenous lines. These are commonly used to deliver fluids and medications such as painkillers, antibiotics, and sedatives. These lines may be in their arms, neck, or groin. Many patients will have a urinary catheter. When someone becomes very unwell, it's common for the kidneys to stop working properly. And if this happens, we can help by using a kidney machine. You might have heard this called renal replacement therapy or dialysis. We also use specialist mattress and beds to reduce the risk of skin damage. So you'll notice that patients are frequently moved from side to side, and sometimes we nurse them on their tummies. With certain conditions, staff may wear a gown and specialist masks. This will be explained to you if required. You may see other pieces of equipment not covered in this video, and bedside nurses will be happy to explain these to you. We need to have a very high standard of infection control, so please help us by using hand gel before, after, and throughout your visiting. Before visiting, it is important, if you feel unwell, to ask a member of staff for advice. Unfortunately, we cannot accept flowers in the unit, so please don't bring them. We have a person-centred approach to visiting, which means there are no set visiting times and will be guided by patients on who they want to visit, when they want visitors, and how they would like their visitors to be involved, or if they just want to rest. We encourage you to complete the What Matters to Me board at each patient's bed space. This allows staff to understand what's important to the patient when they may be unable to tell them. Nutrition is very important for getting better, and we absolutely do encourage support from family with patients who may need assistance with feeding. But if this is not required, try to minimise interruptions when patients are having their meals and allow them to eat their food at their own pace. Due to unforeseen circumstances, it may be necessary to reduce visiting. However, we will try to inform you in advance should we anticipate this happening. Our patients are cared for in an open environment, so we ask that you consider the needs of others when visiting. And there may be occasions when staff may request you step out of the unit for a short period to allow for care, and we ask for your patience during these times. We have several relatives' rooms, which you can access if you need a quiet space for private conversations. Please ask a member of staff to arrange this for you. We are constantly reviewing the way we look after our patients to make sure we provide the best care possible. To help with this, we have ongoing projects that you and your relatives might be asked to help with. Check out our What's Going On board in the waiting area to see what we were up to just now, and please feel free to ask questions about any of these projects. And on the wall in reception, you'll find leaflets outlining some of the support services available to you. We understand that this is a difficult time, so if you have any questions, please don't hesitate to contact a member of staff who will try to help you with your concerns.